Alright, so today we're going to be talking about gestational diabetes. Gestational diabetes is a little bit like diabetes type 2, in which your body develops insulin resistance. But the difference this time is, well, the mother's pregnant. So, in a normal pregnancy, you have your pancreas, and in the B cells, we release insulin. This insulin goes towards target cells and promotes uptake of glucose into those cells. So, after a meal, your blood glucose is super high. So this highness is denoted in two arrows. Later on, we stimulate the beta cells to produce insulin, and this insulin puts it into the cells and reduces the blood glucose by quite a large margin. But it still has a little bit more blood glucose, which then goes towards the fetus, and this fetal growth is dependent on this blood glucose. So in a mother with gestational diabetes, it's basically around the same. The pancreas still have B cells, and stimulating these B cells will release insulin towards the target cells. There's a problem here because the target cells developed insulin resistance. So the reason for insulin resistance is not very well known, but it's proposed that it's because of the pregnancy releasing hormones and the fetus releasing hormones. And these two together promote slight resistance to insulin. So this causes the baby to get some of the blood sugar to the fetus so that the mother doesn't take it all up. So when the mother eats, blood glucose is very high, and we stimulate the B cells, and there's a problem, and there's insulin resistance. So even here, the blood glucose is very high. So this hyperglycemic blood then goes towards the fetus, and the fetus really has to release insulin, the fetal pancreas. And this causes macrosomia, so the baby gets very big because it's taking in all the blood sugar. So there are several risk factors for gestational diabetes. If you're over 35 years old, if you have obesity, if you have a family history of gestational diabetes, and specific ethnic groups have higher risk factors, like Southeast Asians. So the signs and symptoms of gestational diabetes are the 3 P's of diabetes: polyuria, polyphagia, polydyspnea. So how do you tell if you have gestational diabetes? You do a screening. If you have no risk factors, at about 24 to 28 weeks, you do an HbA1c test. Okay.
Go.
All right, so now we're going to talk about the treatments for gestational diabetes. So we split the treatments into 2 different sections. So it'll be pregnancy management and postpartum after the baby is born. So the first thing we'll always recommend for a new mother will be, in pregnancy management, we'll look at their dietary and lifestyle changes. So we tell them to do a little bit more exercise and change their diet up. So there are many different diets. There can be a DASH diet, low carb diets, ethnic diets. The importance is meeting the glucose self-monitoring goals. So we want the mother to be checking her blood glucose levels about 4 to 7 times a day. And you want to achieve about a 5.3 millimolar per liter fasting blood glucose, 7.8 after a meal, and 6.7 2 hours after a meal. So these dietary and lifestyle changes is very hard. It's important that the patient complies with it. So as long as they meet those levels. So if you can't manage it with just dietary and lifestyle changes, we can do medication as well. So insulin is the first thing recommended for patients with gestational diabetes. This is because there's a chance that metformin or other drugs pass through the placental barrier. So we don't want to do this, so we do insulin as a first priority. However, new research has found that metformin is a viable, safe alternative as well, with not very much effect. So, next we'll talk about postpartum care. After the baby is born, there's a chance of infant hypoglycemia. So the infant keeps producing insulin, so the insulin levels is very high, and the baby has hypoglycemia because it's outside of the mother's blood. So we do a glucose infusion. So there's also a chance of hypocalcemia where there's too low calcium levels, in which we'll do a 10% calcium gluconate infusion. There's also a chance of high bilirubin levels, in which we do phototherapy. And there's a chance that there's respiratory distress, where we do an intratracheal surfactant therapy, in which an RN or a physician will insert tube down the trachea and put in surfactant. Okay. So now we're going to talk about long-term prognosis for gestational diabetes. So there's a future risk of obesity in the infant. There's a future risk of infant and mothers developing type 2 diabetes. And in the future pregnancies, there's a chance of developing gestational diabetes once again. Alright, so thank you for watching our video for gestational diabetes. So please remember to hit the subscribe button and hit that like button too, okay?